Hello, and welcome to my video where we're going to be talking about the adrenal gland and epinephrine, and we're also going to be talking about the disorders that go along with cortisol. So just kind of random information that you need to fill in for your notes, and then disorders at the end. Okay, to start off, I just want to go through some general information about the adrenal glands. So they are sitting on top of our kidneys. They look like little hats for the kidneys. And they have two different portions of them. So we have the medulla, which is the inside, which is regulated by the nervous system, and the cortex, which is the outside, which is regulated by hormones. In Bio 30, we no longer need to know the difference between the medulla and the cortex. You just need to remember that all of it is the adrenal glands. But just in case you come across those words, that's what they mean. So the adrenal medulla is what is releasing our short-term stress hormone, which are epinephrine and norepinephrine. Again, we don't have to know norepinephrine in Bio 30. We just need to know epinephrine. But this is going to start a fight or flight response, which is going to increase the blood glucose level, so you have more energy in your blood to fight off whatever you're fighting or run away from whatever you're running away from. Okay, it's going to increase our heart rate, our breathing rate. It's going to increase the size of our blood vessels so that more blood can travel to our body, like our muscles, so that we can get more oxygen to our muscles. That means we can do cellular respiration better, and our pupils are also going to dilate. So epinephrine is something that we release from our parasympathetic nervous system. This is what starts this whole process. And I also just wanted to mention that epinephrine is what is in an EpiPen. So when someone is having an anaphylactic reaction and their bronchioles are restricting, their air passages are restricting, when they put a shot of epinephrine in their leg, this is going to put them into fight or flight and open everything up to make everything hopefully a little bit easier to breathe. So that is why it's called an EpiPen, because it's literally epinephrine. Now, I'm going to talk about cortisol disorders. So I just wanted to mention what cortisol was again. Remember, it's a long-term stress hormone, and normally it goes hypothalamus, which releases a releasing factor to tell the anterior pituitary gland to release ACTH, and the adrenal gland will release cortisol. And it does all these things, so it tells the liver and muscles to do all these amazing things like increase the amount of amino acids in the blood to help recover. Sometimes we take the amino acids and make glucose. We have more energy. Okay, and normally it will control weight, fight off infection, help with the quality of skin and bones, and heart stuff. Okay, but if cortisol is too low or too high, we might have some problems. So first of all, if we have too much of our cortisol, so hypersecretion of cortisol is called Cushing's syndrome. Okay, it could be because of a tumor on the adrenal cortex, or it could be because of Cushing's syndrome, which is a disorder itself, causing a hypersecretion of cortisol. So some of the actual symptoms that you can see in someone who has Cushing's syndrome, something called moon face. So basically fat deposits in their cheeks, so it makes their face more round. They could have osteoporosis, okay, because in the last slide I talked about how cortisol affects bones. Okay, osteoporosis is a bone disease where we don't have strength in our bones. Okay, high blood pressure, a pendulous abdomen. So this is when they're having fat kind of hanging out in their abdomen, but their arms and their legs would still be fairly small. So you'll notice that these people often will get very large markings on their stomach from their abdomen growing so quickly. And also something called a buffalo hump, which I absolutely hate that it's called that. It just sounds so horribly mean. But basically, again, fat is depositing in just specific areas of the body. So you can see that there's a small fat deposit on the top of the back. And also it would take a long time for these people to heal from wounds because their immune system would be compromised because their cortisol levels are so high. Okay, the other option of something that could happen is a hyposecretion of cortisol. So too little cortisol would cause Addison's disease. So Addison's disease would be someone who has a lot of weight loss or low energy, low blood pressure. And then something else that could happen is something called hyperpigmentation. So you can notice in this individual, he has a darker spot on his tongue, in his gums, okay, on his hands and his feet. You can see darker pigmentation. Also in this person's lips, that darker pigmentation would be a sign that they have Addison's disease, which means that they don't have enough cortisol. Okay, so they're not able to increase the energy levels in their body. So that would cause them to lose weight because they're going to end up finding other sources to find energy, like proteins and fats. Okay, they wouldn't have a lot of energy because of this reason. Their blood pressure would be low, and then the hyperpigmentation is not something that we can like explain in Bio-30 terms, but it is just something that is kind of a characteristic thing that you guys should know about Addison's disease. So those are the two diseases that you have to remember for cortisol. So hopefully that makes sense.